About 8 years ago, I started going through some physical and emotional changes, and eventually I started becoming a stranger to myself. When I finally went to the doctors, the lab results revealed I have hypothyroidism. This tiny butterfly shaped gland in the throat failed to function properly and caused all the changes that I was going through. According to the American Thyroid Association, or the ATA, about 20 million Americans, that's more than 12% of the US population, has some form of thyroid disorder. 60% are unaware they even have it, and 1 out of 8 women will be affected. That's 5 to 8 times higher than men. The National Institute of Health, or NIH, claims that about 4.6% of the US female population between ages 12 to 60 have hypothyroidism. I want to share with you what hypothyroidism is, some of the causes, symptoms, and the diagnostic and treatment methods to help you understand more about hypothyroidism. Medline Plus summarizes it as the condition of the thyroid gland that fails to produce enough of the thyroid hormones that regulate the body's metabolism or the bodily functions, such as the rate at which you burn calories or the rate your heart beats. Some of the causes are congenital, something that you're born with, diet, too much or not enough iodine can affect it, thyroiditis, which is the inflammation of the thyroid. The National Institute of Health states that some of your heart, cancer, or bipolar medications can have an effect. Diseases. Medline Plus states that Hashimoto's disease, which is chronic thyroiditis, and autoimmune diseases are the most common causes, and thyroid surgery and radiation treatment are also causes. Some of your symptoms include fatigue, depression, inability to focus, and mood swings, weight gain. In a matter of 2 years, I went from this to this. I'm now a happy middle. Constipation, swelling of the extremities, dryness of the skin, eyes, mouth, and hair, intolerance to cold, which leads to decreased sweating, thinning of the hair, joint and muscle pains, and heavy or irregular periods, which was what led me to the doctors. Amongst your diagnostics and treatment methods are most commonly blood tests. There are 5 types of blood tests: TSH, T3, T4, thyroid antibodies, and TSI. Imaging such as ultrasounds, thyroid scans, and radioactive iodine uptake tests. These are my lab results. These are my thyroid scans, ultrasounds. Treatment is most commonly some kind of synthetic synthroid or levothyroxine. The ATA states that you can, some people refer to use CAMs, which are complementary alternative medicines, which is supplements. There's several other over-the-counters. Just be very careful selecting them. Always consult with your physician. Diet. They say black beans, avocado, a lot of your greens are great sources for your thyroids. And of course, diet and exercise. I hope that sharing some of these causes, symptoms, and diagnostics and treatment methods will help you understand more about hypothyroidism. Maybe this information will help you or someone you know who may be experiencing these symptoms of hypothyroidism and ask your doctor. While hypothyroidism primarily affects women, It also affects men and those that are around us. Thank you.